Okay, so let's start with environmental health next. The sources that you need to know or to refer to that are related to environmental health, it's mostly the acts and regulations. So that's the Environmental Conservation Act or Atmospheric Pollution Act, Hazardous Substances Act, as well as Sustainable Development Goals and the National Development Plan and others. There are quite a lot of them, but you just need to at least know what they are about and how they are implemented to protect the environment and health as a result. So, with regards to sustainable development goals and the national development plan, these actually go hand in hand. So, the sustainable development goal is what is it's a global initiative or a global plan that countries came and had an agreement as to how to address the issues that we have globally. And then South Africa as a country came up with the National Development Plan. They call it the National Development Plan 2030, whereby they are now trying to implement sustainable development goals to make them happen in a way. So the ones that are focused or with regards to environmental health, sustainable development 6, 7, and 11. So you need to know those ones and know what each represents. So you need to know 6 is for clean water and good sanitation. 7 is for affordable and clean energy. Um, 11 is for sustainable cities and communities. So you need to also know within each sustainable development goal, what is the plan? What is it that has been stipulated as to how are we going to achieve, for instance, with Sustainable Development Goal number 6, how are we going to achieve clean water and good sanitation? Right. So, um, so with these ones, you need to, especially when you answer questions regarding the Sustainable Development Goals, you need to also think about the current developments or delays in some instances in our country with regards to making these sustainable developments happen, right? Um, we'll go to this question. Let me just go to it quickly. Okay, the question says describe the effectiveness of the National Development Plan vision towards attaining SDG number 6, 7, and 11 in order to achieve environmental sustainability. So it's a describe the effectiveness, like how effective has it been? How effective has the National Development Plan 2030 vision has been in our country in ensuring that we achieve SDG number 6, 7, and 11. I'll make an example with clean water and good sanitation as the SDG, just looking at its effectiveness currently, because this national development plan is what we want to achieve by 2030. So if we say by the year 2030, we want to ensure that there's clean water and good sanitation. Currently, what is happening in our communities are the toilets, proper working toilets within our communities to ensure good sanitation. Does everyone have, running tap water with clean water, so you look at that and that's how you respond to the question of, okay, the National Development Plan uh, towards attaining SDG number 6 is that the plan was to implement running water within communities. And then currently what's happening, do we really have running tap water? So you will say, oh, in some communities there are running tap water, in other communities there aren't. You can also base this on the community that you are in. or the community that maybe you are allocated for, especially in your clinical placement. So you can use that as an example to justify your answer as to respond to whether it has been effective in attaining SDG number 6, for instance. So with these SDGs, there's a lot that has been planned, and you will mention all of that and also mention whether it has been achieved or is it in the process or there's a plan towards that, or so that's what it requires. You can also mention some legislations maybe that have been put in place in order to ensure the attainment of the SDGs. Like, for instance, again, with the water example, this has been the national water policy that has been implemented in ensuring that there will be adequate water for all communities. All communities are able to access clean water and so forth. So that national water policy is sort of like a legislation that is foreseeing the implementation of that, which essentially will then make the SDG number 6 to be achieved. So you can use such examples. So SDG 6 has a lot of plans that they've written under, how to achieve the clean water and good sanitation. So you can talk a lot about it. And then you also talk about SDG number 7, Leona, which is affordable and clean energy. You can mention how there's, for instance, with regards to ensuring that there's electricity in most communities, what is being done or what was the plan, and has the plan been has it been implemented, or is it in the process of being implemented? I think under that there's where they talk about alternative energy sources like solar power, or what's this? The use of LPG, which is liquid petroleum gas instead of paraffin, because paraffin is greenhouse emissions which pollutes the air. So now it takes away the environmental sustainability. So you'll talk about such things. And so that's how you will respond to this question. Then you'll do the same thing with also SDG number 11 that talks about sustainable cities and communities. This is the one that talks mostly about housing. So the plan was that most of communities do have housing, a safe house to stay in. Has that been implemented? And an example of that could be, I think it's RDP housings that have been implemented in some communities. So that's how you show there was a plan and it has been implemented. So it shows the effectiveness of this National Development Plan 2030 vision. So, yeah. And then with a question such as this one, this is the match column, and it wants you to know your acts or these legislations and what each represent or what they are about. I think if you have just an idea of what the act is about, then you'll be able to match it to its description in column B. So, for instance, look at the first one, the Tobacco Control Act, number 63 of 2008. When you read the statements in column B, when you look at number B, it says to protect the rights of citizens by discouraging the use, promotion, and advertising in order to reduce the incidence of tobacco-related illnesses and deaths. So if you know what the Tobacco Control Act is about, you'll be able to note that it actually does match this description B. So your answer to 2.1 will be B. So you do the same with all of them. And like I said, for you to know which description best match the act, you must know what each act represents. And from there, it will just be um, easy for you to answer a question such as this one. Okay, this is another similar question. Same thing, it has to do with, again, the legislations in column A. And if you know what they are about, then you'll be able to match them to the correct description in column B. So just go over your acts, know your acts, know what they are about, and you'll be able to answer this question. So this one speaks of the Occupational Health and Safety Act. So it says employers have an obligation to employees to ensure a safe and supportive environment as stipulated in the Occupational Health and Safety Act. For this one, this is where you need to go into detail with regards to knowing about this particular legislation. So that is, you go into the legislation and you find out what does it stipulate regarding the responsibilities of an employer in the prevention of injuries in the workplace. And you can also look, I think there's also the responsibilities of an employee in the prevention of injuries in the workplace. So, a question might also come up like that. So once you know what these responsibilities are, and then you can be able to describe them. So by describing them, you may also make examples just to help with justifying your answer. Broad. The environment is very broad, and you should. It has different. It's like when we talk environment, we're talking about the air, we are talking about the land, we're talking about water. So you need to sort of like put them in that way, and then think of all the health problems that arise from each type of environment. So I think this one you can find you can find it in the National Environmental Policy. That's where it talks about it. Check page 20. This is where it talks about all these health problems. Uh, like I'm saying, when you think about this one, it's just one of those questions or things that you don't necessarily need to cram, but you just need to think about the environment that you're in or the environment that you are placed in your clinical placement. So, for instance, when we talk about, say, the environment, there's water pollution, you'll think of all the diseases that are resulting from water pollution. So, this is where they talk about waterborne diseases, and so that's how you would think of such. Yeah, and then also when you think of air pollution, if the air is polluted, then we're going to have acute respiratory tract infections. This is where we're going to get lung diseases. Like you get where I'm coming from. So when you think environment, think of the type of environment and think of what health issues can arise from that. So it's spoken of water pollution, uh, or maybe poor sanitation can also be a result regarding water. And then we've also spoken of air, and then we can now also talk of land. If there's land pollution, um, what health health problems can we get from that? So another one is they talk about vector-borne diseases. These are those that are transmitted by vectors. Vectors can be animals or insects. An example that they do is malaria. Um, Again, when you think of environment, you can think of the geographical area. because with malaria we get it in tropical areas where the weather is usually on the hotter side of things. So when you think of that, then it will remind you that, oh, there might be malaria mosquitoes around there, and therefore there will be malaria cases. So that's a vector-borne disease. Another one is foodborne diseases. So this can be if there's poor sanitation. Again, it can also fall into poor sanitation if the water um, if the water is polluted by, let's say, a sewage drainage going into the water supply that is used to, wash your veggies, or used for cooking, then that can result in foodborne diseases. So thinking about it like that would help you not forget anything. And then another one is chemical or pesticide poisoning. This is when, just think of vegetation, when we grow our crops and then somehow we use pesticides to, remove insects from eating our way, our growing vegetables. Then we're introducing pesticides, and that will result to pesticide poisoning or chemical poisoning within those crops that we are later then going to consume. So just think of an environment in that way, and you'll be able to answer that question. So a similar one is, it says analyze the health problems emanating from poor environmental hygiene. So that's how you would approach this type of question. Back to legislations that you need to know. There's this one called the National Environmental Health Norms and Standards for Premises and Acceptable Monitoring Standards. So that one is the one in which environmental health practitioners, it serves as a guideline for environmental health practitioners, especially with regards to monitoring public facilities, such as old age homes, beauty salons, and childcare centers. Those are actually the top three important ones that are usually discussed when we do environmental health um, for community health. So with that one, you need to know what the role of the environmental health practitioner is when they visit those facilities, right? So there are things that they check, such as whether the facility is registered and it has been issued with there's the health certificate for that facility to be operating, and they also inspect and look at the structural and the physical facilities as to whether is it up to par or up to standard. So make sure you read on those, all three of them, know all three of them, old age homes, beauty salons, and childcare centers. Know what the environmental health practitioner looks for during visits to those facilities. So yeah, if you do make sure to know all three of them, then it won't matter which one comes up, because one of them might come up, but it won't matter which one. So what you can do is that there are some similarities amongst the three. When you look at the first one, looking at whether the facility is registered, they do the same for all of them. They'll check if it's an old age home, they'll check if it's registered, they'll check the structural and physical facilities. So it might differ when it comes to maybe the structural facility, because an old age home will not have the same structural um, thing, the structural facility as a beauty salon and or as a child care, a creche, So you just now must differentiate. Okay, in an old age home they look out for this, in a beauty salon they look out for this, in a creche they look out for this. But the similarities that they will check if it's registered and it has the certificate issued by the environmental health practitioner. And under the registration, they check the details of the owner, the physical address, whether it matches to where the facility is actually at, whether the services that are offered there are permitted to be offered, and also when was this certificate issued and is it still valid. So that's one of the similarities amongst all these facilities. And then now you look at the differences amongst the three of them. So an example question was, describe the information you would give to the management of an old age home regarding the structural toilet and ablution facilities requirements for an old age home. So that means you should know what the structural toilet and ablution facilities of an old age home should be like. And this is something that you will know once you have read through under old age home. So you check that legislation, the National Environmental Health Norms and Standards for Premises and Acceptable Monitoring Standards. And I think it's somewhere around page 30, from page 30 going down, they talk about all of these things. Principles of environmental health. So this is when we're trying to resolve environmental health issues, right? So principles would be, I've always struggled with understanding what principles are, but over time I got to actually understand, but now to explain it. So, okay, principles are basically, it's like what needs to be done or what should apply for something to take effect. Yeah, I think that's as best as I can explain it. But for, like, in this instance, the principles of environmental health. So if you want to resolve environmental health issues, what needs to be followed is principles, also something that needs to be followed. So these are the principles are what are found in the National Environmental Health Norms and Standards. This is, I think it's one of the legislations that's under the National Health Act. So these principles are stipulated. There are 11 of them in total, and you do need to know all of them and know how to explain them. So prevention at the center of all environmental health needs. That's, I think, the first one that they talk about. Okay, prevention of these environmental health issues as part of environmental health intervention strategies. So these are just strategies that we come up with in order to resolve environmental health issues. So in order to do so, we need to follow these principles. And the first one is the prevention should be at the center of all environmental health needs. The second one is equity in environmental health services and so forth. So it's just about understanding them and what they actually need, what they actually mean. I'll make an example of a few of them. I won't go over all 11 of them, but I'll just make examples of a few of them. There's also the one in recognition of equity in environmental health interventions. So this means that, just in simple terms, I'm just explaining it in my own words, but you can read what they say and also try to put it in your own words. But it's saying that as we try to address these environmental issues, we need to acknowledge and address the fact that there are disparities, there are differences in environmental health to ensure fair and just access to resources and benefits. So making sure that we recognize that there are differences in equality within the community, and even the access to resources amongst members of the community or different communities will not be the same. So as a result, as we try to resolve these health issues, we need to take into consideration that matter. So we can apply it by, say, for instance, we implement policies of activities that will prioritize the vulnerable communities, or let's say the disadvantaged communities. So meaning that within the equality spectrum, those that are less resourced, we try to implement policies that will make sure that as we come up with these strategies, they too benefit. And it's like trying to balance out if something already has more and the other has less. When you come up with resources, those that have less, you would want to actually give a little bit more than those that already have enough. You know what I mean? So that's basically what it means. That one, yeah, recognition of equity in environmental health interventions. At the same time, it means that we need to make sure that everyone will have equal access to these resources. So let's say now there's just everyone is in need of resources. So when we distribute the resources, they must be equally distributed. You know what I mean? So that's the approach. Um, another one, let me just try to, another one is community participation. That's also another principle when it comes to resolving environmental health issues. Remember to win over the community, especially if you come up with strategies, it can include programs or projects, community projects. You want the community to participate in this project because if they do not participate, the chances of the project actually taking effect or even becoming successful within the community is going to be low. So to make sure that it is successful, you need to involve the local communities in decision making processes and even in the actions that are involved in the project or in the implementation or even the planning. In fact, from the planning of the project, you need to make sure that they are involved and they participate. So that addresses the community participation principle. So how it can be applied, because sometimes they are required to show or to apply the principle. So you can engage the communities maybe when you are identifying the environmental health problems and also in prioritizing them. Have them participate in the identifying of the problems and even in which one should we start addressing first, because they are the ones who are experiencing the problems within the community. So they would also be the ones to know which one is it that they want it to be addressed first, or to be solved first, and maybe which type of program or project to be done in order to address that. So that addresses the community participation. So I've just touched on those two, but basically with all 11 of them, more than anything, try to understand what they actually mean. Put yourself in the community where, I'm not sure if you guys have already done the the environmental health study. Yes. So some of the steps that are involved in that environmental health study, they include some of these principles because, in fact, these are connected. The environmental health study is following the principles of environmental health in addressing environmental health issues. So knowing the principles means you would then know how to conduct the environmental health study, if you know what I mean. So yeah, make sure that you do understand them, you know how to apply them, use the examples that you have been exposed to or you have observed within the community that you're in or within the community that your clinical placement is at. So this question discussed the role of environmental health practitioner within the primary healthcare ward-based outreach team regarding appropriate medical care required for children within the community child care centers. So again, this goes back to what we spoke about earlier on, which is knowing what do environmental health practitioners look out for when they do the visits to these public facilities, when they do their inspections, what is it that they look for? And with regards to now, specifically now to childcare centers, which are the creche, you need to know in terms of the medical care that is required for the children in that creche, what is it must be that must be within the facility. Some of the examples are there must be, for instance, an emergency medical kit should a child have or sustain a minor injury, then they're able to be attended to using that medical care equipment. So that's just one of the things. But if you go through um, all the requirements of what a community childcare center should have, then you will know and have a response for this question. Thing that we should know regarding environmental health is now the role of the community health nurse, which is us now. The role of the community health nurse in environmental health. So one of the roles is to conduct an environmental health study. And the environmental health study, it has its process, which has its steps that are followed. Um, and within those steps, the okay, before we get to the process, there's roles, just the general roles of and community health nurse, environmental health. So it's some of them is conducting an assessment for environmental hazards, and when you look at these, they actually go hand in hand with the process of conducting an environmental health study. So the roles would be conducting an assessment for environmental health hazards, so meaning identifying environmental hazards within the community that the community nurse is working in, understanding the environment where the patients live. So usually community health nurses will know about the community in which they work in, and as a result, they will understand the environment of where their patients are living in. Then also the third one, they talk about exploring factors contribution or contributing to environmental health hazards. So looking now, okay, you see there are environmental health hazards, but now what are these factors or what are the things that are contributing to these health hazards? That's also another role. And then after all of that, they will plan interventions through health promotion, disease prevention, disease resolution, and restoration strategies, which is what we do as nurses. And then they would have a positive impact of good environmental practices on prevention of illnesses. So, meaning that in having an impact on the community to ensure that they develop good practices that ensure that there's prevention of illnesses. Like, for instance, remember during COVID-19, everyone was encouraged to wash hands in order to reduce the spread of illnesses because the problem was already identified, which was COVID-19. Then the cause was identified, which is it spread in those different ways and also contacting, infected people. So meaning that to prevent it, you must wash your hands. So that's how it goes. And then another role is performing activities to address environmental health problems within the community. So this is now coming up with these programs or projects that will ensure that we minimize or we address these environmental health problems within the community. So those are the roles that they say the community health nurse has in the environmental health. Now, when you tie it together with conducting an environmental health study, which has a process, like I said, a following the steps that thing. And the first step of conducting an environmental health study is the assessment of the determinants of health. So you assess all the health issues based on what determines them, or determinants of health. And these are usually categorized. We have different categories of these biology of these determinants. One of them being biological determinants, um, psychological determinants, environmental determinants, social cultural determinants, behavioral. So those determinants need to be assessed uh, based on the community whereby the environmental health study is being done. Um, an example is biological determinants. That's when we're talking about age, we're talking about gender. So we look at all these health issues that are caused by age, or that are caused by um, whether it's because you're female or male. So that's that as an example for biological determinants. We also have environmental determinants, which we would have, as we've mentioned, that when we talk about environment, it's a lot. We can either talk about the environment in respect to air. So if we talk about air and then we look at air pollution, what health impacts would air pollution cause? So that's how you would approach it. So you need to know all these determinants. There's 6 of them. There's a question that, yeah, here's an example. So it says discuss 6 determinants of health that contributes to increase in the severity of environmental health effects. So this is where they want you to now explain or discuss these determinants of health. So another outcome under environmental health is knowing the roles of the environmental health practitioner um, in assisting to support a healthy environment for the community. So this is through services that together with the PHC outreach team, the environmental health practitioner would be rendering these services. So we need to know all these services and how the environmental health practitioner does that. So remember, when you talk about the environmental health practitioner, this is different from a community health nurse. They are all members of the multidisciplinary team, but the environmental health practitioner have their own roles and duties that they have pertaining to environment. So some of these services, conducting vector control, um, ensuring that there's adequate water supply amongst the community, monitoring air quality, um, overseeing wastewater treatment, monitoring waste management. That's their role. That's what they do. So there's a lot of these roles. We need to know all of them. They are on page 124. Yeah, Hatim. So if you go over them and try to find a way to explain them, then that that will help, or just see how they have been explained in Hatim. So knowing these will also help. There's a question that says, what based primary healthcare outreach teams operate within the designated wards with the environmental health practitioner as part of team members? And then it says, analyze the following services rendered by the environmental health practitioner. So the first one, they've listed control and manage unsafe sanitation. So you will analyze this service. The second one, it's water supply. So it means you need to know how the environmental health practitioner, their role in water supply. And then the third one, they've listed vector control. You also need to know that. So here they've only asked for 3 to be analyzed, but there's a lot of them. So that's why we need to know all of them, just in case they ask about any of them, then we are safe. Okay, another outcome is knowing the process of the environmental health study. So this is the one in the steps on how to conduct an environmental health study. And we've already spoke about the first step, which is the assessment of the determinants of health. So that's the first step in the process of conducting an environmental health study. And then the second step would be, after now you've assessed the determinants of health, it is now followed by planning and implementation of intervention strategies. So it means based on those determinants of health that you've identified and assessed in the first step, you now come up with intervention strategies, you plan for them, and you implement them. So some of these examples for intervention strategies can be just a simple health education on how to prevent illnesses. So, or maybe the spread of illnesses within a community. So you can plan the health education and then implement it. Another one that they mentioned is advocating resolution measures. So this is when you now include the stakeholders that related to the problems or determinants of health that have been identified. So one of them is the environmental health practitioner. You involve them in the planning and the implementation of these intervention strategies. Also, not forgetting the community as a whole. Remember, now back to community participation, you want them to be part of the planning and the implementation of these intervention strategies. And then other stakeholders can be maybe the community councillor, who usually is the leader of the community. So you can also include them in any other stakeholders that are relevant to the environmental problems within this community. So that's what you do. So that's what we do in the second step of the process, yeah, in environmental health study. And then the third stage or the third step would be now the evaluation of these intervention strategies that we have planned for and have implemented. So we want to now evaluate the effectiveness of these strategies, right? We want to see, are they working? Are they bringing a change? So we look at the prevention measures, we look at the resolution measures, and we also look at the restoration measures. These are found in one of the books. I forgot. Yes, but this where they explain them so well. So if you can go over prevention measures, resolution measures, and restoration measures. Usually the confusion is between resolution measures and restoration measures. But going through them will help with understanding this third step of the environmental health study. And then now there's a question relating now to step 2 of the process, which is the planning and implementation of intervention strategies. So the question says, okay, it starts by saying communities in the greater parts of South Africa are experiencing environmental challenges such as inadequate food supply, water pollution, air pollution, poor supply of clean water, and refuse disposal. And then it says, plan and implement the intervention strategies to address the above mentioned environmental health hazards. And it wants you to tabulate your answers. So on the left side, or on the left column of the table, they've titled it health hazards. So it means it's those health hazards that they have listed for us at the top. So there are 5 of them. So it's inadequate food supply, water pollution, air pollution, poor supply of clean water, and refuse disposal. And then on the right hand side or the right column, it's intervention strategy. So they want you to now list or explain the intervention strategy for these health hazards that they have given us. So again, it will help to go back to the process of the environmental health study, go to the step 2 of the planning and implementation of intervention strategies, and think about how you would plan or implement an intervention strategy for instead inadequate food supply. How would you solve such a problem within a community? So if there isn't enough food supply, one of the strategies could be to starting the garden projects where the community can have like a community garden when they plant their own vegetables and they get to um, take food from there. This is going to help with solving this inadequate food supply problem. So you do that for all of these health hazards that they've listed. So that's what they want from us in this question. Okay, so outline the principles of environmental health which are aimed at resolving environmental health issues. So we've already gone through a question like this one. This is the same as question 7, which had said describe the principles of environmental health intervention strategies that are aimed at resolving environmental health issues. So it's one and the same question, so it's expecting the same response, but you need to look at these instruction verbs. Every time we answer a question, we are guided by the instruction verbs. So the first question, it outline the principles. So you need to understand what are they expecting from you when they say outline. And then this one, it describe. So again, you need to know what it means to describe, like how much detail must you give in your response when they say describe. And between the two, outline would probably have less detail than describe. When you describe, you really want to go into detail and give examples and justify, whereas outline is just outlining the principles, just giving them what the principles are. So otherwise, it's one and the same question. Here's another one. Discuss the determinants of environmental health hazards in the community. We've gone through a similar question which had said discuss 6 determinants of health that contribute to increase in the severity of environmental health effects. So these ones, even the instruction verb is the same, it's discuss. So when you discuss, you want to give detail, you want to give similarities, differences, that's you discussing. So the only difference here is that in the first question, they didn't specify how many determinants, they just said discuss the determinants, whereas in this second question, they say discuss 6 determinants. So, but otherwise, again, it's the same question.